Hey guys, what's going on? It's Bobby G back again. Hope you're doing well. Hope you're safe out there. Today's episode we're going to talk a little bit about is headache pain and some of the muscles on the board that can contribute to that headache pain. Lately, a lot of my clients have been telling me, hey Bobby, I've got some headaches in the front, behind the eyes, on the side of the head, the back of the head, and a lot of times it's these muscles that we're going to talk about that are causing that stress and those problems. Because mainly what happens a lot of times people, especially now with all the stress going on, people are really kind of biting down on their jaw, biting down on their teeth, and causing a lot of stress internally in the mouth and in the head area, causing a lot of internal pressure, which causes headaches. I tell people if you hold your breath long enough, you're either going to pass out or you're going to get a headache, you know. So a lot of times that's not a good thing. So you don't ever want to valsalva, which is holding your breath. You don't ever want to bite down too hard. You got to let the muscles of the body relax. It doesn't matter what muscle it is. Over time, they're all going to either, get caught up and have trigger points, stuff like that. So these few exercises I'm going to give you on how to calm these muscles down are going to be very, very good. The two skeletal areas I want to talk about are basically your maxilla and your mandibular. So you have the maxilla in yellow, and then the white is the mandibular or the mandible. When you have the stress clenching, what happens is the teeth or the jaw comes together, putting a lot of stress on the teeth. And that's kind of known as Newton's third law, which basically every action has an opposite or equal reaction placed upon it. So then you get a negative pressure in there, which that pressure ends up going to the ligaments and the joints and the joint capsule, especially the articulating joint capsule of the lateral pterygoid, which is not good. So we want to make sure we can calm these muscles down, and I'll give you a few ideas on how to do that. Okay, so the first muscle we're going to talk about is the masseter. Its job is to elevate the mandible, so bring the mandible up. The masseter runs from the inferior angle of the zygomatic arch to the inferior angle of the ramus, so it runs kind of in this direction. Okay, its job is to elevate or bring the mandible up. Okay, so closing your jaw. It's also known for stress clenching, which we talked about with that negative pressure. So we want to make sure we don't stress clench. And a lot of times this is causing headache pains as well. So the next one is going to be the temporalis. Its job is to also elevate the mandible as well as retract, so bring the mandible backwards a little bit. Okay, so closing the jaw and retracting the jaw, that's its job. It runs from the temporal fossa all the way down to the angle of the ramus here. So it runs kind of fan like that. So its muscle fibers has got a little bit of a different pull, okay, as opposed to the masseters kind of almost run up and down. The next one we're going to talk about is the frontalis. So that's the muscles just above the eyebrows. So it actually takes the eyebrows and lifts them up, and it kind of scrunches the face. But it can also cause a lot of headache pain in the frontalis area. So a lot of times when you massage the front of the eyebrows, it will calm down the frontalis muscle. The next one we're going to talk about is the occipitalis. So it runs right in this area here. It takes the eyebrows and lifts them up, and it kind of scrunches the face. So you've got muscles from the spine that come up and attach to the occipital bone. You've got the suboccipital triangle muscles that attach from C1, C2 up to the occiput. So its job really is just an anchor for those muscles. The next thing we're going to talk about very briefly are the lateral pterygoid and the medial pterygoid. Now the reason I'm not going to talk too much of those is a lot of times I actually have to have the person open their mouth and I go inside the mouth and I work inside the mouth because it's hard to get these attachments in the belly of the muscle from external. It's very, very hard. So most of the stuff has to be internal, so we have to go inside the mouth to reach the medial lateral pterygoid. Now they're very, very important, especially the lateral pterygoid because it has an articulating disc capsule that articulates with the temporomandibular joint. So that's very, very important to understand that muscle. And then there's the medial pterygoid, which is a very, very important muscle as well, but it doesn't have an articulating disc and capsule. But it does have a huge pull laterally, which means when the jaw closes or opens, it goes side to side. So those are very, very important. But those I'm going to talk to you more on another video, or if you come into my office, I can give you more of a detailed description of how I treat those and why we treat those as well. Okay, so for the next demonstration, I had to take my glasses off, so Mr. Jones Bones is holding them for me right now, so I can actually show you the motions of the masseter, the temporalis, and the frontalis. Okay, so remember the masseter just runs kind of at this angle. So what you want to do now, any of these exercises you can do seated, standing, lying down. Of course, I always recommend lying down. It's the most comfortable. But for whatever reason, if you're behind a desk and you just cannot lie down, you can actually just somehow relax your jaw. And what I don't want you to do is clench, okay? You can bring your teeth together if you like, but you don't want to clench, okay? So for this one, kind of bring your teeth together, and then I'm going to not talk so I can show you the exercise. So you bring your teeth together, and then you're going to do glides from top to bottom, okay? So now, in those glides, if you feel a trigger point, please stop on that trigger point, put a little pressure, and count to about 10, and you should see that trigger point dissipate. And if it definitely dissipates, then you know for sure it's a trigger point. If it doesn't dissipate in 10 to 15 seconds, then you may have to come back to it because the muscle is probably compressed a little too much and it needs a little more time to relax. Okay, so that's going to be the masseter. Again, find an area, hold it 15 to 20 seconds, and you can do that 2 to 3 times for 15 to 20 seconds, and then switch sides if you need to do both sides. I would recommend doing that definitely 3-4 times a day, especially if you're doing a lot of clenching or you're waking up with headache pain or jaw pain. So the next one is going to be the frontalis. Remember, it goes from the temporalis fossa and it ends up down here at the ramus. But remember, because of its fibers, they kind of go at an angle. So make sure your angle of motion and massage is kind of down towards the ramus here. Okay, so you want to go with that fan angle. Larger, getting smaller. Same idea, not a lot of pressure. You don't have to glide too fast. If you find an area that's tight, hold it 15 to 20 seconds. If that area dissipates, then you know it's a trigger point. So again, you can do that as well. I would recommend 2 to 3 times a day with that as well, and especially before you go to sleep. All of these exercises I give you before you go to sleep, because they'll put you into that rest and digest, that parasympathetic, that we talk about in a few other videos, and that's what we need to make the muscles relax. Because usually a trigger point in a muscle is a lactic acid buildup because that muscle has just been used and overused to the point where it now is either locked short or locked long. And so a lot of times these muscles in the jaw, when they're locked that way, short or long, you end up having referral into the head, getting a lot of headaches. So the next one we're going to talk about is the frontalis. Okay, so that's the muscles that raise the eyebrows up and down. So all you have to do basically is just kind of rub from the top of the eyebrows down through the eyebrows. Okay, don't go into the eye socket, but just go to the bridge of the eyes. So you'll do that 15-20 seconds. Again, if you find an area that is tender, you feel free to hold that area, and that'll help calm those trigger points down. Now, any of these exercises that I gave you, you can do what they call cross fiber. Most of the stuff I gave you is what they call with fiber. That means the fiber direction of the muscle. So if the muscles are running this way, you're doing fiber directions this way. If the muscles are running that way and you're going this way, you're doing cross fiber. So you can cross fiber the masseter. You can cross fiber the temporalis. You can cross fiber the frontalis. And then the last one, guys, is going to be the occipitalis. And this one, again, like I said earlier, is just really an anchor point for a lot of muscles. So what you kind of want to do is I like to run from like superior to inferior. So you just kind of grab the top of the head and you'll just kind of run down, okay? Just run down from the top part of the bump here and then run down. Right into this fossa here, or this dip in the back of the head. Just running around like that. Again, you can also, if you find an area, a trigger point, you can put a little pressure on it, okay? The one thing I like to show people too is I have these yoga tuna balls, and they're very, very good. They actually come in this tote, or you can get 2 tennis balls and put them in a sock or whatever you want to do. And a lot of times these occipital muscles in the back, they're very, very hard to get to. So I tell people what you want to do is take the 2 balls in the sock, you want to put it here, and then you want to lie down and then just put some static pressure. So it would look like something like this. And you would lie down on it. And these yoga tuna balls will release the pressure on the occipital area. So you guys be well, be safe, God bless, and we'll talk to you soon. Bye-bye.